It's a delight and privilege to catch up with Miss Elizabeth Kurian, CEO of Mission for Vision. Elizabeth, thanks for taking the time to catch up.
Thank you, Vinod. It's a pleasure. Thank you for having me.
Elizabeth, I mean, for the people who are going to be viewing this little segment, I'm just wondering, would you be able to talk a little bit on Mission for Vision and what it does?
Sure. Mission for Vision is basically a not-for-profit organization. We were founded in 2000 with the sole vision of eradicating avoidable blindness in India through comprehensive, high-quality and equitable systems in different parts of the world where we work. We work in India, Nigeria, and more recently in Bhutan. And the fundamental premise of our work is that we believe that poverty is a cause and effect of disability. And if you're able to help eradicate avoidable blindness, there will be a significant impact on the social lives of people, the quality of life of people, and therefore the economy of the nation. And finally, contributing to the global goal of eradicating poverty.
Well, thank you so much. And you personally and Mission for Vision, you do fantastic work. You worked, all across in India. I understand you worked in about 100 districts in about 20 plus states. You also work with a number of partner hospitals, 34 to be exact. Now, I was just wondering from your experience, what are the priorities for eye care in India, and would they continue to be priorities over the next decade?
Sure. I think one of the greatest challenges that afflict developmental processes is lack of adequate human resources. Whether it's eye health or education or anything, human resources are key. You need a certain number of a certain skill and capacity, but we don't have that. Look at optometrists. We have around 40,000 in India, both people with degrees and diplomas, and we need more than 125,000. So we just about meeting 30% of the need. So there's a huge challenge there. So human resource development, I would call it number one. And if you were to really eradicate avoidable blindness, you have to reach to the most remote communities, whether they're rural communities, tribal communities, urban slum communities. So how we ensure sustainable, comprehensive primary eye care systems, very important. Vision centers is one way forward. And we also need to demystify the more complicated diseases that are difficult to handle, for example, retinal issues or glaucoma, through enabling appropriate screening of these conditions and also post-management of these conditions at the primary level by optometrists and others. It's very, very important. The other thing, is if you look at the quality of eye care, India has come a long way in terms of the number of cataract surgeries we do. Cataract being the main cause of avoidable blindness in India. But the quality is still not appropriate. It's not adequate. If you look at the last survey, it says that 6% of blindness in India is due to failed cataract surgeries. So more attention to quality and increasingly more attention to partnership as well. More engagement with the private sector. I would say these are the priorities the way I look at it.
And just following up from that, in terms of projects, your organization's done projects all through India. And what do you think are the key elements, especially when you go into rural India, you work with underprivileged communities, etc. What do you think are the key elements that are needed to make it both successful and sustainable?
Sure, Vinod. I think we as a country, India, we are fortunate that we have a policy environment. We have a conducive policy environment that prioritizes on health and within that the prevention of blindness. We've had a national commitment since the year 1976, perhaps the first country ever globally. That provides us with that environment. And also globally, there is attention to blindness. You have universal eye health as a policy and a very clear goal for the world. So that is very important. You have the luxury or the fortunate opportunity of working within that field. The next is, I think, a very clear vision and a strategy that can be implemented, with the right skill sets. People is very important. the leadership that's required, people of the right number and the skills and capacity. So I would say people as number three. Then very important is partnerships. You have to work with others, right from people at the community level, wherever you're working. Whoever is willing to join hands with you, it's very important, to make that meaningful association. And eye health is an area where you see impact very clearly and almost immediately. So it shouldn't be a challenge to forge partnerships. And last but not the least, finance and financial acumen. And again, because our sector is one where you can see the impact more clearly, there's an opportunity for us there.
And maybe if I can ask one follow-up question. I mean, I've heard many people debate on this between, organizing camps to having a longer-term vision center, in a rural part of India. I was just wondering what your views would be on that.
Absolutely. I would always say that it's always advantageous to have a permanent, sustainable solution for the community. So the vision center is always there for the community to access whenever they want. The other advantage of having a vision center is you can have people who are from the local environment, you train them and they can take care of the eye health needs of their own community. Over 75% of the needs can be addressed. I will not dismiss outreach camps totally. They have their place. Whatever success India has achieved over the years is largely because of outreach camps, but they're gaining less significance with time. But there are certain pockets of the country, for example, the desert areas, the remote tribal areas, that still need those camps. Need the camps to go out and convince people. And camps also provide confidence to communities where you have the hospital team going and screening, talking to them, counseling, taking them to the center of care. So in the long run, definitely vision centers would be a priority for the country, and now especially with the COVID scenario, very, very important. And you have a number of examples where you see vision centers performing very well.
Right.
We ourselves have long-term strategy of 500 vision centers coming up over the next decade, if not a year.
Yeah. And my very last question is, you had so much experience working on eye care projects across India. You worked with so many partners. You learned many valuable lessons. So I was just wondering whether you could pick a few things that should not be done, and based on either you working with a particular partner and learning from that process kind of thing. So I was just wondering whether you would like to share some aspects with viewers.
I think one is you shouldn't work in silos. Very often, due to various reasons, either because you're not sure of what you're doing or you're too sure of what you're doing, you end up working by yourself as an organization. You don't engage much. You have to go out and reach out to the community. You can't go and sort of provide service to the community without engaging them. It's partnership right at the community level. Even otherwise, whether it is for strategic reasons, for training, or research or evidence, even for policy matters, you need to engage because unless you are able to take out what you have learned and share it with others and work with others, then only can you replicate and scale. Otherwise, the world is never going to be able to tackle this problem. So one is partnership to avoid silos. Certainly, it has to be avoided. Second is very often, because cataract is a major cause of blindness, we tend to focus on cataract and cataract surgery, which is important. I don't deny that. But then, how do we maximize what we do to look at things more holistically? How do we use our experience with cataract to train more people? How do we use the data we have, the learning we have to generate evidence for the sector? How do we partner with others to scale up what we're doing? So, not, one is, of course, avoid working in silos, and second is, broaden your horizons and do not, work with a very narrow vision. That's what I would say. And there are ample opportunities for us to go beyond that.
But thank you, extremely valuable advice. Thank you so much for taking the time to chat with us. Best wishes in everything you're doing. Thank you.
Thank you again, Vinod. Thank you for having me, and it's wonderful to be able to chat with you and also work with you.